Good afternoon. Madam Chair, you may begin the hearing.
Thank you. Good afternoon and welcome to the U.S. Access Board's Artificial Intelligence virtual hearing for the disability community. My name is Katie Kale. My pronouns are she, her, and as a visual description, I am a white woman with long, light brown hair. I'm wearing a black top under a coral blazer, a very bright coral blazer, and I'm wearing dark rimmed glasses. I'm sitting in my office in front of the American flag and the General Services Administration flag. Thank you for joining us today. I'm a federal board member of the U.S. Access Board, as well as the Deputy Administrator of the U.S. General Services Administration, or GSA. I am proud to serve as the chair of the U.S. Access Board, as well as chair this hearing. The Access Board's mission is to create access for all. The Access Board is an independent federal agency dedicated to accessible design for people with disabilities. The board is comprised of 25 individuals, 13 of whom are appointed by the president, and the other 12 are representatives from various federal departments. I would like to acknowledge my federal board members that have joined us here today for the hearing and thank them for making time. I would also like to take a moment on behalf of the board to additionally thank today's presenters and all of those in attendance for being with us today as we discuss artificial intelligence in relation to the disability community. So a few housekeeping notes as we begin. The hearing is being recorded. American Sign Language interpretation and real-time captions are being provided. All attendees will remain muted with your cameras off until you are being called upon to speak. You may then use the chat feature to communicate with the host if you need additional assistance. For all board members, presenters, and for those that have pre-registered to offer public comments, please take time now to ensure that the name that is listed on your Zoom screen is your full name so that we can easily identify you and provide you the permissions needed to speak during the hearing. On the screen, you will find the agenda for today's hearing. To go over the agenda, after my welcome remarks, we will begin the hearing with Allison Levy, Director of the Office of Technical and Information Services for the Access Board. She will provide some foundational background on our AI series. After Allison, we will hear from a wide range of presenters on the uses, benefits, and risks and barriers for people with disabilities regarding AI. Following the presentations, Access Board members and staff will be able to ask panelists questions. Afterward, there will be time for public comments from those who have pre-registered to provide public comments. Let us begin by welcoming Allison.
Thank you, Katie. It's a pleasure to kick things off with a little background information. Let's start off with the first slide. First, for those of you who are new to the Access Board and who we are and what we do, I'm just going to provide a little information about our roles and responsibilities. We were established to develop accessible design guidelines and standards, including the Architectural Barriers Act, the Americans with Disabilities Act, Section 508 of the Rehabilitation Act, and others. We also provide technical assistance and training on these standards and guidelines. And we also enforce the Architectural Barriers Act standards, which apply to federal facilities and federally released facilities. Next slide, please. So last fall, President Biden issued an executive order on the safe, secure, and trustworthy development and use of artificial intelligence, with the intention to maximize the benefits and minimize harms of emerging AI technologies. To that end, the Access Board was tasked with several asks. Next slide, please. So 3 items. First, we were asked to solicit public participation and conduct community engagement. Second, we were asked to issue technical assistance and recommendations on the risks and benefits of AI, including biometrics as a data input. And last, we're hoping to provide people with disabilities better access to information and communication technology, as well as transportation services. As a result of those asks, we developed a memorandum of understanding with 2 key partners, 2 national nonprofit disability-based organizations, the Center for Democracy and Technology, otherwise known as CDT, and the American Association of People with Disabilities, AAPD. You'll hear from them in just a few minutes, but wanted to fill you in a little bit and bring you up to speed on where we are with our outreach efforts. Today's session, or this afternoon's session, is the 3rd in a series in which we're hearing from different folks in the community about AI, risks, and benefits. We kicked off our series first with a foundation of information on artificial intelligence to help reach out to all of our communities to establish a foundation of understanding on artificial intelligence. The second was a hearing hosted this morning to the disability community, and we heard from some wonderful presentations which highlighted risk benefits associated with the use of AI in the disability community. And then that brings us to this afternoon, where we are hearing from a second group of people. We're very excited about the panelists coming up. And our next issuance of a hearing will be on August 22nd, where we will hear from practitioners in the artificial intelligence field, as well as federal agencies on what they're doing in the AI space. So with that, let me kick things back to Katie for the next introduction. Thank you.
Thank you, Allison, for that foundational information. I'm excited that we will now transition to the panel presentations part of the hearing. Our panelists will be sharing general AI benefits, AI risks, and touch on the current research, employment, and other related AI topics. We ask that all panelists keep their presentations to around 8 minutes, and if they have slides, they should be prepared to share their screen at the time of their introduction. As a reminder, please keep your cameras off until it is your time to present. We ask that all others remain muted with cameras off. Okay, so we now welcome Henry Claypool, technology consultant from the American Association of People with Disabilities, and Ariana Abulife, the Policy Council for the Disability Rights and Technology Policy Center for Democracy and Technology, for their presentation on MOU Partner Insights on AI for People with Disabilities. Henry and Ariana, you are welcome to begin.
Good afternoon, everyone, and thank you so much for the introduction. My name is Ariana Abulafi. I'll give a brief visual description. I am a youngish person with sort of past shoulder length brown curly hair. I have gray rimmed glasses. I'm wearing a black t-shirt and a gray blazer. So I'm going to be speaking very briefly today just about our partnership a little bit. I am the Policy Council for Disability Rights and Technology Policy at the Center for Democracy and Technology, and I lead our disability rights work. I am so grateful for the partnership with AAPD and with the Access Board and our work with executive order implementation to engage the disability community and those interested in understanding how to ensure that AI is deployed in a way that is helpful for people with disabilities, and to sort of paraphrase the executive order, in a way that increases the benefits and also minimizes and mitigates the harms for people with disabilities. So this is our third, I guess, session in this group of sessions on AI and disability. We had a disability community session earlier this morning, and we also had a session a couple of weeks ago that was entitled A Foundation on AI and Disability, and that one is on the Access Board website. And I wanted to give a quick little recap of some of the things we spoke about there. So we gave definitions of AI because it's really important to sort of couch these conversations in what it is that we're talking about, what it is that we mean when we talk about the impact of AI and algorithmic systems on people with disabilities. So we defined AI and machine learning and generative AI. We discussed some of the uses of AI. We mentioned that, oftentimes federal agencies will use AI as ways to hopefully make things more streamlined and faster and easier, and sometimes even less biased. And that, unfortunately, that is not always the outcome. We mentioned some of the ways in which people with disabilities are using AI, sometimes in assistive technologies. And we also mentioned how AI can impact people with disabilities right now. We talked about how artificial intelligence tools are being incorporated into all sorts of different systems that people with disabilities interact with every single day. That can include education and employment. That can include healthcare and benefits determinations. And we mentioned some of the ways in which those sorts of tools, when used in those contexts, can have discriminatory outcomes and problematic outcomes for folks with disabilities. What you're going to hear in today's session is hopefully more about some of the ways in which people with disabilities use AI, some of the benefits, some of the risks, some of the potential concerns, and hopefully some ways to recommend mitigation of those concerns. These listening sessions provide the Access Board, AAPD, and CDT another opportunity to center the experiences of people with disabilities and to understand the impact of AI and emerging technologies on our community. It gives us the opportunity to foster dialogue with federal agencies and with industry on the use of AI. And it gives us an opportunity to continue to raise awareness for how disabled people experience AI. Because AI tools, they are being used right now, which means that some of the benefits and also some of the concerns, they are happening right now. But these tools will only continue to be incorporated into more and more aspects of our everyday life. And so it's really important that we hear from the community now, that we start to hear from the community, that we continue to hear from the community as to how folks are interacting with and experiencing these tools. Our next to last session and our next session is going to be on August 22nd, where we look forward to hearing from federal agencies and other practitioners. And then we'll have a final session in mid-November with the Access Board to release a report that will hopefully support future work on AI from both within and outside the disability community. So we are really looking forward to this hearing and to continuing our partnership with the Access Board and with our community as well. And thank you so much. I will kick it back over to you, Katie.
Thank you, Ariana and Henry, for your work on this very important topic, and thank you for your presentation. So next, we are going to welcome Erie Meyer, Chief Technologist at the Consumer Federal Protection Bureau, CFPB, on biometrics of data, people with disabilities, and the impact on credit ratings. Erie, you are welcome to begin when you're ready.
Thank you so much, and good afternoon. My name is Erie Meyer. As you heard, I'm Chief Technologist from the Consumer Financial Protection Bureau. I am a white woman with brown hair. I'm sitting in my home in a floral chair in front of a map and lamp. I'm so glad to be here today. My agency regulates consumer finance. These are things like credit cards, but also debt collection and student loans. And there are a huge number of things that we regulate or oversee that impact communities such as the one we're talking about today. So I want to start with the really good news, which is that there's actually no exception in the law for fancy technology. That means that the rights that you have won in sometimes very long fights are still yours. That means that the obligations of companies to follow the law don't go away just because they're using AI or fancy technology. And the federal government is building more technical capacity to make sure that companies are following that law. And so I want to give you a couple of examples of the places where the CFPB is working hard to make sure that that is the case today, and special areas of interest for the community of folks with disabilities. The first is around housing. Federal regulators have levied allegations of potential collusion in rental markets around the price of rent. One of the other things we've also seen are allegations around the use of automated valuation models for the pricing of homes. These technologies have challenges even in traditional settings. With the addition of advanced technology, it's critical that the firms understand how the technology is being used, how the data that is training the models is collected, and how those models are unleashed on the public. Our agency is working hard to make sure that these methods are not used to evade the law, that your homes are not rated as less valuable because of the color of your skin, that the cost of your rent is not going up because of illegal conduct. Another area is around data brokers and fraud. We are working on a regulation around the Fair Credit Reporting Act that says if a firm is collecting data about you and using that data to make really important decisions about your life, they need to follow the law. So when this law was passed 50 years ago, I think folks traditionally thought of the credit reporting agencies. Many people know about your credit report or sort of the big three. But in 2024, the data economy looks different. So our job is to make sure that firms, regardless of, again, how fancy their technology is, are really following the law. You may have seen allegations levied by the Department of Justice against several data brokers for knowingly selling the data of people with diminished capacity to firms that were known fraudsters. Those are the types of fact patterns we're very interested in ensuring don't proliferate or expand. And we're really looking forward to our forthcoming rulemaking on data brokers to address things like fraud or potential threats to our national security, but also to make sure that personal health data and biometrics are not used to decide what opportunities are available to you, what options you have when it comes to getting a job or finding a home, anything where you would need a credit report or a background check in order to get access to those services. Additionally, our agency has done work around chatbots and potential violations of law. I think you all may have had the experience where you're trying to get help from a company or even just a straight answer, and you can get caught in sort of a doom loop. You ask a question, you ask for help, and you get passed from person to person. Or in a web chatbot, you ask a question, ask for help, and you get an answer that doesn't make sense. Maybe it's robotic. The firm might want you to think it's simply a hallucination. But when you're relying on a firm to give you a straight answer so that you can access your rights, it's much more serious than that. So my agency has put out a paper around the use of chatbots, both generative AI, cutting edge technology chatbots, and also very simple ones, to say that the existing rights that everyone has in the United States when it comes to getting a straight answer from a financial firm remain in place despite any fancy technology being used. The last thing I want to mention, and then I'll turn it back over, is that my agency accepts consumer complaints on these topics. If your bank, if a debt collector, if a credit reporting agency, if your student loan servicer isn't giving you a straight answer, if you're concerned about having meaningful access to the services you are due, we are very interested in hearing from you about what's happened and how we can help. At consumerfinance.gov/complaint or on our phone line at 866-411-CFPB, we have folks ready to help. You can file online, you can file on the phone, I believe in 160 different languages. We have materials, including videos in American Sign Language and other products to increase the accessibility of our complaint system. It is critical we hear your stories and where you're stuck, because it is our obligation to ensure these laws are followed. So thank you for the time today. I'm excited to hear more and learn more. Thank you.
Thank you, Erie, for that presentation and all that great information. We will now welcome Lydia Brown, Director of Public Policy, National Disability Institute. They will be presenting on AI risks for people with disabilities. Lydia, you may begin.
Hello, this is Lydia XC Brown, pronouns they, them. I'm a youngish East Asian person with short black hair and glasses. I am wearing a dark green and blue top, and behind me, there is a fake background that shows wall to wall and floor to ceiling bookcases in a light-filled room. People with disabilities have long experienced discrimination in all sectors of life, resulting in disparities in outcomes economically and otherwise, including a poverty rate that is twice that of non-disabled people, as well as unemployment rates that are about double that of non-disabled people. Disparities that are greatly exacerbated when data is disaggregated to account for racial and gender-based differences alongside disability. And so it is no surprise that the presence of AI and algorithmically enabled decision-making systems can further exacerbate and amplify those existing disparities. This is for a number of reasons. One is reliance upon data that represents existing inequities and disparities. If an algorithmically determined tool, for example, is making decisions about job candidates, housing, or about credit determinations, and that algorithmically determined tool is relying upon existing data, it will replicate existing inequalities. Conversely, if the data that a particular tool is using is actually unreliable to begin with, the data is not necessarily accurate, the data is not necessarily representative of the full range of experiences of disability, of disabled people, and of the full diversity of the disabled community, then even an otherwise well-designed system will be relying upon unusable and unreliable data to make its determinations or its assessments. The purposes for which AI-generated tools might be used vary widely as well, and generally fall into the categories of assessment, evaluation, and assessment that operate together, of prediction, or of decision-making. And in all of those realms, reliance upon data that either replicates existing inequalities or data that is unreliable will result in further inequitable and potentially harmful and discriminatory outcomes for disabled people. Another way in which AI tools can be particularly dangerous for people with disabilities is if they are not designed with the needs and the functionalities of disabled people in mind. In particular, if a particular tool requires input from or engagement of a user that assumes that all people communicate in certain ways, that all people's bodies move in certain ways or have certain functions, that all people receive and act upon sensory input, whether visual, auditory, tactile, or otherwise, in the same way and with the same mechanisms for accessing a device or accessing a software program, then those programs will inevitably end up discriminating against people with disabilities, because in the worst case scenario, they will be entirely inaccessible to a disabled person. And in the best case scenario, they may tend to exclude people with disabilities, or at least make it much more difficult for people with a range of disabilities to interface with and engage with that particular tool. AI-based technologies further have the potential to harm people with disabilities when they are supporting public policy aims that are not in line with goals of people with disabilities and the civil rights and independent living movements and the self-advocacy movement led by disabled people. So for instance, if a state agency adopts an algorithmic tool with the explicit aim of reducing the number of individual people who are recipients of public benefits programs, that is a goal that is explicitly at odds with a disability rights movement that aims to ensure that all people with disabilities are equipped with the support and the services that they need to be able to participate in society. And given the currently high rates of poverty and unemployment for people with disabilities, rates that are disproportionately high for our community and higher still for those who face multiple forms of marginalization, that is a goal that will inevitably result in a greater proportion of people with disabilities from being removed from a public benefits program. If the public policy aim surrounding the use of a particular tool is not in alignment with goals of community integration, civic participation, and engagement in the mainstream economy, then that tool is posing a very real and immediate risk of harm individually, as well as at a macro level for the disability community. Further, AI tools that tend to have a discriminatory impact on disabled people will entrench discriminatory practices and policies in society. If it becomes more acceptable, for instance, to use an algorithmically determined method of choosing who will be considered for a job, for access to a rent stabilized unit or a subsidized housing program, or who will be able to maintain access to publicly funded healthcare benefits and long-term services, then it may become acceptable in the public mind to allow existing inequities to grow without addressing the underlying public policy inadequacies of current research, of current practice, of current services, and of the ways in which disabled people are able to live their everyday lives, not just interface with systems, then AI tools that we develop will not exist outside of that context. And that ultimately is what is necessary for policymakers to understand if they don't always know what is happening, because the average policymaker cannot be expected to be an expert on every aspect of the disability community, and certainly not on AI and other algorithm-driven tools. But policymakers do have a responsibility to know that the policies that they are working to develop and implement are done with the needs of the people who have the most to lose, who are most vulnerable and most marginalized front and center in mind. They have a responsibility to ensure that the policies that they adopt will not result in reinforcing, perpetuating, and amplifying inequity and injustice. And so AI tools that we have public funding for, public support for, or public procurement of in particular, should be held to a high standard of accountability and should be held to standards of accountability that reflect back what the priorities and needs are of the communities that are directly affected by them, whether that is in relation to credit decisions, in relation to access to housing, in relation to access to employment, or in relation to access to public benefits programs, as well as a myriad number of other applications possible for algorithm-driven tools. It makes sense when building and designing policies to collaborate with people who are from the impacted community. And both technologists and policymakers have a great deal to learn in that respect from members of the disability community who are well represented here today in this discussion. AI tools exist in context, and that means that to the extent that there are many potential opportunities for benefit for disabled people from growing applicability of AI tools to everyday life functions, then it is all the more important for us to be cognizant and conscious of the great risks that occur with the existing utilization of AI tools, as well as with continued development of AI tools, where we are still working to create policy that works for human beings, where we are still working to create policy that makes sure that people have access to the workforce and education and housing and healthcare. And work that we spend and time and attention that we spend in relation to AI needs to reflect that at the end of the day, it is human lives that matter. And the risks of AI are enormous. And if we work to address them now, then we will be better positioned to benefit from the potential opportunities that AI can offer to making the world more accessible and inclusive for people with disabilities instead. I'll turn my time back over.
Thank you, Lydia. We will now hear from Theo Brady, Executive Director, National Council on Independent Living, on AI benefits and impacts on independent living. Theo, you may begin.
Okay. Let me get started. Again, my name is Theo Brady. I want to talk to you a little bit about myself. My pronouns are he, him, his. My visual description, and I'm a Black man, male, bald-headed, with a salt and pepper beard, glasses, blue glasses. I'm a C4 quadriplegic who uses a complex motorized wheelchair. Been a person with a disability since age 15 due to a football accident. I ran a Center for Independent Living for 31 years, and I am currently Executive Director of the National Council on Independent Living, as well as a member of the National Council on Disability. So let me briefly talk to you about a number of things, actually, Lydia mentioned in regard to the benefits and opportunities for people with disabilities in regard to AI. And so I have a few of those things to share with you. And keep this in mind, AI is moving so quickly that probably by the time this presentation is over with, there's going to be some advancements. And so mine is definitely not inclusive of everything, but I wanted to point out a few things. Assistive technology, speech recognition, right? Tools like Apple Siri and Google Assistant and Amazon Alexa help individuals with mobility disabilities control devices and access information using voice commands. So it's very important. Text-to-speech and speech-to-text, right? Software such as Dragon Naturally Speaking assists those with visual disabilities or motor disabilities by converting spoken words into text and vice versa. There's mobility and navigation. Autonomous vehicles, it's going to be a game changer, right? Self-driving cars like those being developed by Waymo and Cruise and other companies will provide transportation options for people with physical disabilities. And again, I say it's going to be a game changer. It's going to be something that's happening right now and certainly in my lifetime. Navigation apps like Aira and Be My Eyes use AI and human assistance to help individuals with visible disabilities navigate their surroundings. Very key. Screen readers and keyboard navigation allows people with mobility disabilities to also navigate and communicate. Augmentative and alternative communication. If anybody know Bob Williams, he's doing a lot of great work with Community First with this, right? AI-powered devices help individuals with speech disabilities communicate more effectively. For example, speech assistance in regard to predictive text to assisting in forming sentences, real-time translation, AI like tools like Google Translate facilitate communication for those who are deaf or hard of hearing by providing real-time translation, spoken languages into text, right? Very useful to people. Home automation, very important. We saw this even more so during COVID. Smart home devices, AI-driven devices like smart thermostats, lights, air purifiers, and security system, something that was very beneficial by helping people with mobility disabilities manage their home on a day-to-day basis. Again, this stuff is advancing so quickly. I encourage you all to stay and use these kinds of smart devices. Lotus Ring, something fairly new, was presented at the National Council on Independent Living conference, where it's a wearable wing that control objects at your home just by pointing at it. Again, technology is moving so fast. Health and wellness. Again, wearable devices like smartwatches and finger rings can monitor a person's health and alert them when potential health issues come up. Again, something I'm constantly using myself, and others encourage other people to use this kind of technology. Telehealth services. AI enhanced telehealth platforms provide remote consultation, reducing the need for logistic, getting back and forth. We all know that people with disabilities, some cannot afford affordable, accessible transportation and can't get to the doctor's appointment like they should. And again, COVID-19 proved this to be very valuable, and those things are continual post-COVID. Educational tools, personalized learning. AI can tailor educational content to meet the unique needs of students with disabilities, providing adaptive learning experience. Accessibility features in educational software can offer features such as closed captioning, audio description, and customized interface to improve, again, accessibility. Even in the workplace, we see AI taking effect, tools that remove biases of hiring. All right. And one of the things that we got to be very careful of, I think Lydia mentioned it, we've got to be very careful that these AI tools are not being developed based on ableist thinking. So they create another barrier that people with disability have to face on a day-to-day basis. These applications help with task automation and making things more accessible in the workplace in regard to assistive AI and employment. Lastly, I want to finish up with talking to you something personally that I can testify to in my own life, during an emergency situation, right? Dropping my phone or falling, but still being able to contact someone using voice activated commands. I can personally testify that worked in my life. During the pandemic, it was very difficult to a period of my life, and I'm sure many others, but I was still able to use AI assisted devices to do my grocery shopping, my banking, and so on. Household devices, I use it for my lights, my thermostats, my air purifier, and my heater. Heat and coolness can be very devastating to a person with a physical disability. And I was able to use that AI to ensure my own safety. Then with cameras, I use Ring video cameras to see who's at my door, was able to lock it and unlock my door, speak to the people before I even let them in. And we also know how important it would during COVID-19 or any other kind of emergency, how important it is to access information in real time. AI allows that to happen, right? Air quality, we talked about that already in regard to air purifiers. We know how difficult chemical activities can affect a person with a disability. So you can also use that. And again, I mentioned telemedicine. My doctor was rarely available. I couldn't come out to see her. But when I brought her in on video technology, she was right there. Even my pharmacy was based on automation, and they could send my medicine. Socializing during that stay-at-home period, we all know about that, how important Zoom calls was, how we needed to be entertained. And again, we use AI for that purpose. And not only that, we visited and virtually visit our family members to ensure that they was also safe and also could be socialized. And I'm using right now, I'm working at home like many other people are working at home remotely based on technology, AI technology. And we saw post-COVID that employment for people with disability increased simply because of AI technology. And again, we're talking about Alexa, we're talking about Amazon, Echo, Cube, Fire Sticks. All of these things are voice activated that allow you to function in your home safely and securely. Apps can enable a number of skills, such as morning routines, right? Taking my medicine. Sometimes this become very important for people to be able to take medicine on time. And often people forget, but these routines, once set up, can help you. And I can't even talk about how many times I use Audible books and Kindle book to read when I'm not in a sitting position, as well as Facebook Porter, who can follow you around as you talk and take care of business. Smartphones, all of these things are very important, vital, right? I wish I had stock in Amazon because I use them all the time. My DoorDash and Instacart. My wife don't even shop anymore. She makes me do it. Right? These are the things that AI is doing that enhances our lives. It used to be where AI and technology like this was an afterthought. People would develop this stuff and then say, oh, well, all right, this could benefit people with disabilities. Now, big businesses and companies are intentionally looking at what these things could do to enhance the lives of people with disabilities. So again, I say, by the time this presentation is over with, there's going to be some technology that is going to improve the lives of people with disabilities because it makes sense and it's good for business. And people every day are contacting Nickel to say, you know, can you test this or can you test that? All right, in regard to autonomous motorized wheelchairs are being developed. And these are the kinds of things that AI are going to benefit all types of people in the near future. So this was not completely everything. So let's look forward and become educated in regards to all the things technology-wise and AI-wise that can benefit the lives of people with diverse disabilities. Thank you.
Thank you, Theo. I especially liked at the beginning when you mentioned by the time your presentation would be done, there probably would be more AI uses that are out there. I think that's a great reminder of how fast everything is moving. All right, next we're going to hear from Robin Troutman, Deputy Director, National Association of Councils on Developmental Disabilities, on the AI impacts for people with developmental and intellectual disabilities. Robin, you may begin.
Thank you so much, everyone. And I just spilled my water, so give me just a moment. Oh, okay. Hi, everyone. My name is Robin Troutman. I use she, her pronouns. And as it was stated, I am the Deputy Director of the National Association of Councils on Developmental Disabilities, or NACDD. For visual description, I am a white woman and I'm wearing glasses, a black top, and I'm wearing a beige jacket. NACDD works across the 56 U.S. states and territories to ensure that people with intellectual and developmental disabilities can live in the community of their choice and lead a self-directed life. I'm excited to join you today for this important hearing on artificial intelligence and the potential impacts on people with lived experience. Thank you to the U.S. Access Board for inviting NACDD today. A little story. Back in January, I attended a conference for meeting and event planners as part of a professional development organization that I am a member of. They had 3 keynote speakers at different times during the event on the main stage talking about AI. How AI is here, whether we are ready for it or not. How AI should be seen as a tool and not a replacement. And the biggest takeaway from all 3, in the exact same words, AI is not going to take your job or replace a human, but the person who uses AI as much as they use Word, Excel, or Canva will take the job or advance faster and further than those who do not. But what does this mean for people with intellectual and/or developmental disabilities? We have seen already that advancements in technology help people with intellectual and developmental disabilities live more independently, as Theo said, be able to work more efficiently and effectively, and be able to hang out with their friends wherever, whenever they want. But these advancements only help those who can access them. We still have a large digital divide in our country and globally, where more rural and poorer areas do not have access to stable, high-speed internet, which many of these tools and technologies require. According to the World Health Organization, there are more than 2.5 billion disabled people that will need one or more assistive technologies by 2030. However, the WHO, World Health Organization, also states that almost 1 billion of those people cannot access the products. So we have some work to do. As my colleagues have mentioned, since the COVID-19 pandemic, we have seen an increase in applications like Zoom or Teams add AI-generated captions, website accessibility overlays, and other tools, and people including the word accessibility in their diversity, equity, and inclusion conversations, as they should. But these decisions are being made not by the people who need to use them, but by technology experts. As they should, but at the same time, because they are experts in coding and programming. But people with intellectual and developmental disabilities are experts in their needs and what works for them and what does not work for them. If we're able to take a line from the hit musical Hamilton, people with intellectual and developmental disabilities and other disabilities need to be in the room where it happens. They need to be included on research and development teams, included in user experience teams and demos, and in impact or evaluation teams. AI is only as unbiased as the data and algorithms it relies on. We need to ensure that AI is not only intelligent, but also ethical, inclusive, and aware of human diversity. Anne-Marie, I'm going to get her last name wrong, Imafidon, Anne-Marie Imafidon, Imafidon, is a British computer scientist and social entrepreneur. And she states that when a wider range of perspectives inform how new advancements, such as AI, are designed and used, the resulting technology is more equitable and beneficial for everyone. This isn't just a computer science thing. Understanding society is crucial when releasing technology into the world. For example, similar to what Lydia mentioned in her presentation, in their presentation, I apologize. Similar to what Lydia mentioned in their presentation, if you're designing an app for job seekers, you need to ensure you have people actively seeking employment involved in user testing and have people with disclosed disabilities involved in that user testing. STEM, science, technology, engineering, and math, and STEAM, science, technology, engineering, arts, and math work need to represent an inclusive cross-section of society to create the best outcomes possible. People with disabilities, and especially those with intellectual, cognitive, developmental, or neurodivergent disabilities, must be included in the STEM and STEAM workforce. By including people with intellectual and developmental disabilities in the AI and computer sciences and information technology workforce, and let's be honest, all areas of employment, it is less likely to have bias in the AI algorithms. Currently, the algorithms are consciously or unconsciously discriminating against people with disabilities. AI systems learn from vast data sets, which often reflect societal biases. If these data sets predominantly feature able-bodied individuals, the resulting algorithms may fail to accurately interpret or serve people with disabilities. Developers might not fully consider the needs of people with disabilities, leading to products that are inaccessible. For instance, as Theo mentioned, voice-activated systems might struggle to recognize the speech patterns of individuals with speech difficulties. In addition, AI-driven hiring tools might screen out candidates with gaps in employment history due to medical conditions, or autonomous vehicles might not recognize wheelchairs as obstacles, posing safety risks. To combat ableism in AI, it is essential to adopt a more inclusive and ethical approach to AI development. AI systems must be trained on diverse data sets that include representation of people with disabilities and other intersectionalities. We must involve people with disabilities in the design and testing phases of AI development, and there must be ongoing training and education, as well as listening, communication, and transparency. This is not to say there aren't good tools out there currently. Microsoft's AI for Accessibility, for example, projects include AI tools that help blind or low vision people navigate the world and apps that assist those who are deaf or hard of hearing. In addition, there is Voice ITT, which is a speech recognition app designed to understand non-standard speech patterns. The impact of AI on the intellectual and developmental disability population is still relatively new to determine, but if we are mindful of including people with intellectual and developmental disabilities early in the AI processes, then we can see it be used to improve the quality of someone's life, increase employment opportunities, and educate a greater understanding of people with disabilities, all of which creates a more inclusive society. Thank you.
Thank you, Robin. We will now hear from Anne-Marie Killian, Chief Executive Officer, TDI for Access, Inc., and Jeff Shaw, Software Developer, GoSign AI, on the research and impact of AI on sign language interpretation. Anne-Marie and Jeff, you may begin.
Hello, first I'm just testing to make sure you can hear the voice interpreter. Good, you can hear, okay. Perfect, so first of all, I want to introduce myself. Again, real briefly, I'm Anne-Marie. I'm CEO of TDI for Access, and I'm with my partner, Jeffrey Shaw, who is co-founder of GoSign at AI, and I am going to do my image description. I am a white woman, middle-aged, brown hair with wearing black glasses and brown shirt. And before we continue, I just really want to commend the U.S. Access Board for organizing this important event. As we have seen here, in the comments and presentations shared today, it's clear AI's presence in our daily lives requires that we collectively work together to ensure the safeguards and no undue harm on people with disabilities. Today, we are presenting an emerging technologies for language access, representing the advisory group on AI and sign language interpreting. Our advisory group primary goal is to develop inclusive language and access standards for all communities, including sign language users. Our goals, we act on our counterparts to ensure interpreting standards and access to all communities, including sign language. As we act as counterparts to the Interpreting It's Safe AI Task Force, both align and we collaborate together with interpreters and spoken languages. We've been working with the significant resources through hashtag DefSafeAtAI. Reports are available, and you can see the guidance. We study and we do the research and we set that up at the policies and our findings to ensure that safe AI has standards. The engagement and activities involvement to promote and implement these standards. We engage with community through various activities, including webinars, symposiums, and workshops all over to gather the data for our findings. And it's clear to get the messaging and our mission to technology to provide equitable for all disabilities. And I would like to transition to Jeff, who will expand a little more on the technical considerations and motivations of work that are working. So I'm going to turn it over to him to discuss the efforts and the highlights, the distribution of the benefits of AI. Jeff? Thank you, Anne-Marie. And I just want to make sure everybody can see me. Yes, perfect. Okay, thank you. So thank you, Anne-Marie. My name is Jeffrey Shaw, and I'm a software developer for AI company called GoSign AI, specialist in signing captions and data gathering. My image description is I am a white male in my 30s. I have short brown hair and blue eyes. I have a little bit of stubble, and I'm wearing a lavender collared shirt. All right, so one of my favorite quotes by a famous scientist and scholar is the future is already here. It's just not evenly distributed. We've seen this happen many times throughout history. For example, the telephone. It became common in the early 1900s. The at-large population reaped the benefits while the deaf and hard of hearing community was left out until the 1960s when the TTY arrived. Countless other examples now with the emerge throughout history. So with the emerging technology, we hold a great potential, but we have to be assertive in ensuring that it's evenly distributed among the communities. And that new technology is here, and the artificial intelligence, and that word is so overused. It's mostly a buzzword for marketing. I prefer to think of it as a model that detects patterns in new data using prior. Imagine if you asked a kid to draw a picture of a human. What is a kid going to draw? Possibly it's going to draw a stick figure. They haven't been exposed to the art and training, and they haven't seen all the examples of the art and had that. So a kid their model is not competent for that. It's not complete. So it's same with sign language in the model for recognizing and translating and create and generating. How to make sure that it's complete. There's so many different considerations that need to be made. First of all, the data sets, they need to be inclusive. Sign language is just so diverse across the nation, in the country. People sign the same word many different ways. So the data sets need to be inclusive and include all different classes of signing, gender, ages, sex, race, it doesn't matter. So imagine if the model training only was on college age applicants and volunteers. they wouldn't perform as well in countering to the senior citizens. Just like in English speaking, they have accents. There's many signers that have accents as well. For example, in Maine, their sign for their capital city, Portland, is this. It's the same sign as the color purple in other areas. So it's a conflict. So the model needs to be known, and that it's a nuance. And there's many more examples that contradict that. So the models is only as good as the data that it is exposed to. There's many other considerations as well, just like reliability. You know, how to make sure that it is robust. And, you know, what if the power goes out? You know, what if the internet drops? And lastly, how do we evaluate and make sure that we have the checklist and to guarantee that that model is inclusive and safe and effective, and how to communicate that with the public? So the considerations on our minds are when the advisory group and the task force developed policies that, quote unquote, automatically interpret by artificial intelligence, quote unquote, AI by AI, should follow. So now I will explain the principles. And so that we developed with the feedback in the signing community. First of all, the user autonomy. It means that they should be able to decide to use it or not. We need to empower the user to be able to make their own decision. Secondly, the models should improve the safety and well-being for all users. They should feel empowered if they're technically not feeling trapped. And they should be able to not feel that they're stuck in there in this box. The third model is strength and weakness. It should be transparent and clearly communicated with everyone so that people can make informed decisions. And fourth of all, it's very important that providers should be accountable for their errors and harm that is incurred by the models that they provide. If you want to learn more, please, you can refer to the QR code and the link to read the guidance document that establishes and justifies these principles. And you can learn more and why we've established the principles and support the principles as well. So that is what the advisory group is all about. We call upon the U.S. board to take action that aligns with the strategic plan. I pulled out a few of the specifics objectives from their plan. First, your first objective is the technical specifications for the technologies. You know, today, the technical specs for the new models, they're not mature. They are underway and they're being developed in the specs that they're trying to get ready to sample, but the models are already out there and into the wild. So it's really important to follow the design equity principles and to include deaf and hard of hearing community in every part of every step of the design process. Second, we have been engaging with the community and the public and the deaf community through webinars, symposia, and workshops. And they have provided effective learning and users' wants and needs and concerns. So we call on the Access Board to do similar efforts. It's a great start. Third, and finally, we are here to make one very important point. There's a disparity between access to technology between deaf and hard of hearing and the population at large. We need to work together to make sure that these amazing new technologies are evenly distributed. Thank you for listening.
Thank you, Jeff, and thank you, Anne Marie. Okay, now we are going to hear from our final presenter, Melanie Fontes Rayner, who is the Director, the Office of Civil Rights, Health and Human Services on Access to Healthcare and Agency Services for the Public. Director Fontes Rayner, you may begin.
Sure, and thanks for having me today. My name is Melanie Fontes Rayner. My pronouns are she, her, ella. I am a mixed race Mexican American with light skin. My hair is black and pulled back in a bun. I'm wearing a white jacket and I have on bright red lipstick today. So for everyone, we put up this slide just to, maybe we can hold off on putting it up in a second. But so we wanted to talk a little bit about some of the things that our office has been working on. So we are the Civil Rights Office for Healthcare and Human Services, which means it is our job to advance, promulgate, work on, effectuate, implement, and enforce civil rights laws. As part of that, we do that through rulemaking, policy, guidance, and law enforcement. So we have a unique role in this space, and we've done a lot of work already that we're excited to talk about today. So one of those rules is Section 504 of the Rehabilitation Act of 1973. This is a law that prohibits discrimination on the basis of disability when the programs are funded by HHS, so the Health and Human Services agency that is our national office, or when they're conducted by those agencies. So recently we updated our rules when it's for programs that are funded or activities that are funded by this department. And through that rulemaking, we actually took on this issue. So we, in that final rule, tools that use patient information like age or health condition and other factors to estimate the benefits of specific healthcare, also known as value assessment tools, often involve algorithms. Those cannot be used to discriminate on the basis of disability. So what does that mean? So in healthcare, we know these types of tools, value assessment tools, they're used to advise or determine the value, the dollar value of a particular health service, for example, such as a drug, a device, or a surgery. And the outputs of these tools often inform care decisions, such as whether your health insurance company will cover it in the first instance, whether a state Medicaid agency will cover that service, under what circumstances might they cover that, meaning they'll pay for that service. And they might be used to contain costs, so to try to make costs lower, and they might be used for quality improvement efforts. But we also know, right, from our experience that sometimes they might lead to discriminatory outcomes against people with disabilities. When they place a lower value on the life of a person with a disability compared to the life of a person that does not have a disability. So we know, for example, we've seen this before. It's not new, right? So we saw this during COVID-19, for example, when different treatments were denied to people with disabilities. And we know, for example, if two patients have nearly identical characteristics, but one has Alzheimer's disease, a value assessment tool may assign a lower value to that person's overall health because of that illness. And they might have a lower quality of life in such a tool. And so we know that a provider that might use that tool then could use that tool to deny that person a ventilator or some other treatment that would violate the law and is discriminatory. So in short, this rule would prohibit that, which we think is really important. Because again, while artificial intelligence, clinical algorithms, whatever you want to call it, these things are new, but also they're not new in healthcare. We've been seeing algorithms, value assessments being used for a long time in healthcare. And in fact, my office has done enforcement work, and we know that they can be discriminatory on the basis of race, age, disability, right? And we know that we as human beings, we're intersectional. We're not just a woman, we're also a woman who is Mexican American. We're not just a person with disability, we're a person with disability that has gender identity or pregnancy status, et cetera, et cetera. And so in addition to that rule, we also extend that rule and make very clear that it applies in the child welfare context. This is important because, again, we've seen algorithms be used in the human services space to deny parents with disabilities placement with foster kids, to deny kids placement with their own parents because of a disability. And that's why this rule, which has both this value assessment tool and this child welfare provision, is so important in disability. I'm glad that this rule has gone forward. We're continuing to implement it, but also it's really important because while AI is new, a lot of these tools, predictive analytics, clinical algorithms, they have been used in the healthcare space to make benefits decisions, to make social services decisions for a long time. The other rule my staff worked on that is really important in this space is Section 1557 of the Affordable Care Act. Section 1557 is part of the Affordable Care Act. It's a provision, it's a civil rights provision, and it literally says non-discrimination in health programs and activities. And that applies across race, color, national origin, sex, and age, and disability. And so unlike Section 504, which is just focused on disability, 1557 has all of these other provisions and accounts for this intersectionality between these protected classes. In addition, 1557 gives us jurisdiction over insurance, which is something that 504 does not, which we all know algorithms sometimes can be used for prior authorizations, medical management techniques, ways in which you might have restrictions on how you access prescription drugs, healthcare services, and otherwise. So under this new rule, those recipients of HHS funding, so Health and Human Services funding, may not or must not discriminate against an individual through the use of a patient care decision support tool. That includes artificial intelligence tools, clinical algorithms, flowcharts, eligibility tools, risk prediction tools, value assessment tools, and more. And to clarify, we know clinical algorithms are like a step-by-step guide that healthcare professionals use to make decisions about patient care. And those steps are guided by specific symptoms, specific diagnostic information about that patient, that person, test results, other medical information inputs to the algorithm. And then those algorithms determine, again, we talk about whether something's covered whether a particular treatment is needed or should be different. And again, so we know that those things don't always reflect the conversations with providers, and we know that they oftentimes may have input processes that might treat someone differently because of a disability. So we think that there's promise in the use of these tools to reduce health disparities and increase access to healthcare, but we also want to make sure that providers of healthcare use these tools responsibly so that they can be ethical and make sure they're not driving more harm and making sure that they're not inadvertently discriminating through bias. So through this rule, tools that have an elevated risk of discrimination, which might be a tool that has a lot of variables that deal with race or color or national origin, sex, age, or disability, that you have to be able to identify those on the front end before you use them, that risk. And then once you've identified that risk, if it exists, you have to mitigate and prevent that risk from creating discrimination against the person, the patient. So to do this, meaning how do we identify that risk? A provider can ask for clarification from developers of the tool. They can follow federal guidance from authorities on health technologies, such as HHS has put out tools on algorithmic transparency for certified health technology developers. They can pay attention to announcements from professional medical associations and other advocacy organizations on such risk. And they can review peer-reviewed research in medical journals, which might identify such risk. After doing so, these entities must make reasonable efforts to mitigate and prevent this risk of discrimination. Again, what does that mean? That can mean stopping or pausing use of the tool, notifying patients of the use of the tool, so transparency, requiring human oversight. So we talk a lot about human in the loop. So I'm using a tool to transcribe notes, for example, with a patient. I don't just allow AI to transcribe the notes and never look at it again. I check the notes before they're inputted into a patient file, something like that. Developing protocols to design to counter the potential for discrimination. So again, we look at a lot of these assurance labs and other things. We're looking at what is the impact of these tools on people. And then maintaining a list of use of artificial intelligence tools being used so you can regularly check and audit and know who's using them, which is just as important. One of the ways we talk about this a lot is AI generated machine translations. So I get this question all of the time. Can a hospital or a provider use Google Translate or something else to translate and communicate with individuals with limited English proficiency? And again, we know, even just like I speak Spanish, words for Spanish are not the same across even Spanish. So a Mexican American might use one word for bread. A Puerto Rican might use a different word. And so it's really important to have that human oversight over such translations, especially when it comes to medical translation, which this rule lays out requirements. So these are just some of the things that we're working on. We, again, remind folks that when we receive a complaint from the public or we conduct our own investigation based off of something we've heard or read about in the news, we handle these investigations on a case-by-case basis. We're conscious of the factors, including but not limited to the size of the organization, the steps taken by the provider, the risk and what the risk was, policies used to address complaints, what steps has that provider taken in the first instance to mitigate any sort of potential discrimination. Again, we know in healthcare, artificial intelligence is widely used. We know it has the potential to help people, but we also want to make sure that there are strong guardrails in place to protect people as these tools continually develop and continue to be growing in their use. So I look forward to your questions and comments and appreciate the opportunity to be here today.
Thank you, Melanie. We really appreciate you and all of our presenters today I personally found them very informative presentations. I'm so glad everyone took the time to be here today. So at this time, we are now going to open it up to our Access Board members and staff if they have any questions for our presenters. So please note that members of the public will not be permitted to ask questions directly right now, but they may enter their questions into the chat for the record, or they can email ai@access-board.gov if they have any questions for any of these presenters. So I am calling now on my board members. If you have any questions, please raise your hand. And when called on, please unmute yourself and introduce yourself before speaking. So US Access Board board members or staff members. So I see Allison Levy, if you could unmute yourself and put yourself on camera. Thank you.
Great, thanks so much. Thank you, Melanie, for your comments from HHS. I was very intrigued by what you shared today. I do have a question. Is there a requirement under either 504 or 1157 for the service providers who receive federal funding to be transparent when they're using artificial intelligence? I think this is one of the concerns from members of the disability community, because we don't always know when AI is being used, and we don't know if it should even be a consideration for how perhaps our requests for benefits are being considered.
Yes, so thank you for the question. So first, the rule does not require transparency. The rule is actually pretty short with respect to the protected classes, the identification of the risk, and then the mitigation. But the preamble, which is just a fancy way of saying, the description of the rule, all of the stuff that describes what the rule does, is very clear that transparency is evidence of compliance and is necessary as a best practice. And so we have been asked by a number of stakeholders to say that more clearly. And so that's something we're working on right now.
Thank you.
This is Amy. I just want to also open up the question and answer time. If any panelists have questions for one another, you are also free to do so at this time. And again, encouraging any staff members or board members that may have questions or comments for the presenters, you are also welcome to raise your hand at this time as well.
Allison.
I'm just going to keep asking questions if it's okay. My question is, it seems there's a consistent theme throughout all the presentations that people with disabilities need to be included and at the table as the data is being collected and the algorithms are being developed. So my question is to all the panelists, whoever feels comfortable answering, how do people with disabilities get more engaged? How do we get to the table and make sure that our data and our characteristics are being fairly used?
I'm happy to start if none of the other panelists want to start. I saw you come off camera, Robin, so I don't want to cut in line if you want to go first. Yeah, so I think a lot of that has been done on the HHS side with respect to comments on these rules that we've done. So the Office for Civil Rights has put out 2 different rulemakings on 1557. We received over 85,000 comments, including a number of comments specifically about this provision and disability. With respect to Section 504, that rule also got, in fact, so much comments that we actually added in some of this stuff to the final rule. which isn't to say it's done, but I do think this community, the stakeholders, the advocates, the legal folks have done a really good job of putting out this work to make sure it's inclusive. The other thing I would encourage folks to do is engage with federal agencies, right? So we do stakeholder roundtables, we do stakeholder work through conferences. My staff is always available to go regionally, locally to convenings or get on to have conversations with folks if folks want. And so I think that's another way that we're trying to better inform our work, and not just at OCR, but across HHS, right? Because HHS has a pretty significant role on artificial intelligence. And so making sure that we make space for this has been a priority of OCR and a priority of the secretaries as we do commenting on public benefits, as we do things around this work. And so I think that's one way in which to do so. I would say the other way would be, I mean, just like we're doing today, right? Commenting on what we're seeing externally, making sure that some of these organizations like Google or other organizations that have pretty big footprints here are also having those conversations as well.
And this is Robin. I did it again. I think the most important thing is that companies that are creating the algorithms, they need to hire people with intellectual developmental disabilities, other disabilities, deaf, hard of hearing. They need to be hired. The best way that we could get people with disabilities into these conversations is for them to be employed. So we need to do lots of things, both with the federal government and increasing asset limits and letting people actually have competitive integrated employment will get them to the table faster than anything. They need to be hired. They have lots of information to share. They just need the opportunities.
The only thing I would add to that too is there's been a lot of work. So I do a lot of engagement with tech companies on this space and a lot of the hospital systems in particular. And I think a lot of the hospital systems, a lot of them are doing really positive things in this space. I'm sure you can appreciate that some of them would rather not have a lot of regulation in this space, period. And so I think that's another important place to make sure that there's patient consumer voices on those dialogues. So hospitals understand what this community will, I want to say demand, but that's requests as part of use. And I think it's really important in those dialogues because they're using these technologies now. And, a lot of hospitals have patient representatives on their boards. I mean, forcing those sorts of dialogues, I think is really important as well, because they have the power to go to these, tech development companies and say, be inclusive. They're powerful stakeholders and they need to make sure that that's inclusive of the disability population.
As a follow-up, I just think that a lot of people with disabilities are not aware of when and how AI is being used. So I think it's important to emphasize transparency as we move forward in this space as well. Thank you. Thank you both.
Thank you. Anne Marie, I see your hand is up. Do you have a question or would you like to add to that previous discussion?
Thank you. I just wanted to make a comment for the question from Allison. So it was a great question. So I want to invite people to the table for the discussion. We recognize that there's different people with disabilities that are aware of AI and the impact, and still many just don't realize that AI has been around since the 50s. So the information and the education and the rights and all of that, there's no formal regulation from the government body observing the AI today. There's different stakeholders involved in the discussions. And so I feel strongly that it's a wonderful way to really leverage the different consumer organizations who are committed and invested as part of the outreach and collaboration with them to be part of the discussion, as well as how to reach out, because often the discussions are happening, but where's the call to action? What does that look like? How is it impacted? Because one size does not fit all. There's so many different needs and so many different communities that and of their needs, and just the awareness. It's a big concern. It's an easy target to community and take advantage of them. So with the AI, so I really encourage us as part of this discussion, invite people, diverse people and different groups to the table who have lived experiences every day in those situations, because often decisions are made for individuals who have no background or experience in that field of disability. So it's really important, and I encourage in the rest of your discussions for that.
Thank you, Anne Marie. You mentioned making sure you're inviting people to the table. I always like to say we just need to build a bigger table. And so I think that goes along with what you're saying. All right, so now we are going to turn to the public comment portion of the hearing, which is to hear from the public on the intersection of disability and artificial intelligence. So for those of you who have pre-registered, as mentioned at the beginning of the hearing, please ensure that your name in Zoom appears as your full name that you registered under, so we can provide you the permissions to unmute and to turn on your camera. We're interested in hearing about your experience with AI, accessibility barriers, concerns, and ways that AI has also benefited people with disabilities. We want to hear about your experiences and concerns related to AI. Each pre-registered speaker will be given 2 minutes. Amy Nieves, Access Board Public Affairs Specialist, is going to call on the speakers by name and assist with unmuting as needed. Finally, I just want to note that our board members are here to listen to your comments, but we will not have time for dialogue in this forum. So let's get started. Amy, will you please call the first registered speaker?
Thank you, Madam Chair, and for everyone for being with us today on the hearing. The first person that is registered to provide public comment today is Carol Tyson. Carol Tyson, if you are on the call, see that you are, you're unmuted, and you should be able to turn your camera on if you'd like. When you are ready to begin speaking, please introduce yourself by your name, and if you are representing an organization, please also share your organization. And when you're ready, you can begin your 2-minute public comment.
Thank you. Good afternoon. My name is Carol Tyson. My pronouns are they, them, and I am the Government Affairs Liaison for the Disability Rights Education and Defense Fund. By way of visual description, I am white with short hair and an upper body amputee. Thank you for the opportunity to provide testimony on DREDF's views regarding artificial intelligence, which include its use in clinical settings and autonomous vehicles. States, health plans, and healthcare providers are using AI and automated decision-making tools, or ADTs, to establish clinical care standards and in other areas. As has been noted, AI and ADTs are trained using data and outcomes that can be rife with assumptions and bias that devalue the lives of people with disabilities and health conditions. When disability intersects with marginalized identities, AI bias can further stigmatize patients, misdirect resources, and reinforce or ignore barriers to care. DREDF is concerned that civil rights enforcement mechanisms, policies, and agencies are ill-equipped to deal with decisions made and ethical obligations met in part or entirely by ADTs. DREDF recommends that healthcare entities provide plain English and translated explanations of when and how AI is used, including in any benefits denial, provide an accessible, readily available appeal process, and proactively track, analyze, and report on how decision-making is kept bias-free. In addition, DREDF seeks to ensure autonomous vehicles live up to the promise of increased safe, equitable mobility. There is a high likelihood of underrepresentation of people with disabilities and critical infrastructure in AV AI datasets, and potential for devaluing of disabled people's lives in algorithmic scenarios. Bias in AV detection and algorithms can lead to serious harm to people or their assistive devices, and there is no time to appeal, and who is liable is still uncertain.
Carol.
Draft recommendations, can I have like just 30 to 15 seconds?
Give you
Do you need me to
15.
stop?
Yes.
Okay,
You just
thank
wrap up that
you.
final
Yes, I am wrapping up. Draft recommendations include transparency, standard setting, and disability community engagement at every stage of development. We publish briefs and comments on these topics and impacts of AI and Medicare Advantage plans on our website. And we look forward to working with everyone to ensure inclusive, equitable use of AI. Thank you.
Thank you so much, Carol. Appreciate your comments. Okay. The next person that had pre-registered to speak today is Emily Cran King. Emily Cran King. I'm not seeing you in the participant list, so just want to do one last call that if Emily Cran King is on the call and you are not listed by your name in the participants, if you could please rename yourself so that we can identify you and allow you to speak your comment. Check one more time. Okay, I'm not seeing any hands raised or anyone by that name in the participant list at this time. At this time, those were the only two people that had pre-registered to provide public comment. In the closing remarks, our chair will go over how, if you are here today and you have wished to speak your comments, there is a way for you to provide written comments, and you are also welcome to message us in the chat. But at this time, we will close the public comments as I am not seeing Emily Cran King in the meeting room at this time. So I'll pass it back to you, Madam Chair.
Wonderful. Thank you, Amy, and thank you to our public comment speaker today. As mentioned, we are going to move to closing remarks. So as we end this hearing, I want to reiterate our thanks to all of the speakers and attendees. I know that coming to a hearing takes some effort, and I appreciate that you made the time to come here today and provide the Access Board information on artificial intelligence. I speak for the Access Board when I say we heard your perspectives today. Your comments will help shape our efforts to create access for all, especially regarding artificial intelligence and disability. We have one more hearing on AI coming up in addition to the two that were hosted today, and that information is going to be on the screen now. So there will be another hearing. Yep, there we go. There will be another hearing on August 22nd, 2024, from 2 to 4 p.m. Eastern Time on Zoom at the link shown on the screen. At the August 22nd hearing, we will hear from federal agencies and our industry practitioners on best practices for AI regarding disability and accessibility. And we hope you will join us. As a reminder, public comments will still be accepted until August 31st, 2024. Those who wish to share their perspective or their public comments, but did not get to do so today during the hearing, please email your public comments to events@access-board.gov. Include AI written comment in the subject line. Make sure you include your name and organization if applicable, and specific AI topic with your comment. Written comments are limited to 300 words. You can reach the Access Board on the topic of AI by email, and that's AI@access-board.gov. And all hearings and our AI series information is available on our website, www.access-board.gov. I also encourage you to please subscribe to Access Board News to receive updates regarding the hearings and other news. And that's access-board.gov/contact. This concludes the Access Board's virtual hearing on artificial intelligence. Thank you.